Any of you were the youngest? And you're the only. How about, who was the youngest though? Yeah, was it kind of cool when the other ones left?
No.
No. Because then they paid all their attention to you?
Yes.
Okay, was it?
Yeah, I was going to ask, we talked a lot about the relationship between the kids and the parents relationship to each other, but what about the relationship between the siblings themselves? Like, where does that play in?
You know, it can play in, but I think, at least in this is the kind of a classic model. It doesn't always go this way, but the notion is that unconsciously, the family is so merged and not differentiated that there's a lot of anxiety about what's going to happen. So that anxiety about what's going to happen is experienced by the girl as, I can't control what's going to happen to our family. The family can't control it. The family is changing. Maybe consciously as well, I can't control this. I can control my body, I control what I eat. And it sort of takes on a life of its own. But she may really be expressing the fear that the family's going to come apart, as if the sun disappeared and all the planets just left orbit. And if you strengthen the parental relationship and you allow the girl to identify with the father as well as identifying with her mom, that takes away that power struggle. Because after all, and this is where you get into psychoanalytic ideas, but you know, there is a way in which anorexia kind of, well, it ends having a period, right? Your body becomes kind of prepubescent because you're so thin. You kind of lose your, you know, the sexual, physical power of becoming a teenager gets undone, right? I mean, it's a pretty radical solution to the problem of feeling out of control, and yet it may be unconsciously a way that she's keeping the family from growing, because it's as if she doesn't age, then the family can't grow. And in fact, the family can't grow. I mean, maybe the 18-year-old is starting to have second thoughts about leaving home after all her sister's so sick. And the 25-year-old is feeling guilty that he's in California. And the parents are kind of like grumbling at each other because he's blaming her for this. And so if you go in and you work on the family system, then things change. Oddly. Yes, Jessica.
I think it's kind of interesting that it's such a common thing for there to be like a strong kind of alliance between, you know, an adolescent girl with her mother and this type of illness, just because at least my experience with it has been, you know, push everybody away. That's what my experience has been with just do everything in my power to alienate everybody and to push everybody away.
There are many, I don't know what a family therapist how they would think about your family, but they certainly would do a genogram and try to figure out where is the underlying struggle, who's being punished, right? Maybe in your family things are actually more disengaged rather than enmeshed. And that's another picture. You know, if I had, you know, several hours with you or you had several nights going, I could probably
But isn't it like a characteristic of anorexia to try to hide the behaviors?
Sometimes it's like I want to. It's like I want
Like,
to, you know,
in some situations it's like that, but
Yes.
in other situations I feel like there's
I think
a
that
desire to hide it to keep so you can keep doing it.
Agreed, but I guess what the family therapist would say is once it's an episode, it's affecting the whole family system.
Okay.
Even if you're trying to hide it, another part of you is doing it. You really can't hide it, right? How am I doing? I'm doing the right time? That's good. Let me just take you into a couple of more complicated examples. How about that? Yes?
What if your mother influences the daughter, like, you know, the classic, like, do you really think you can eat that?
Well, you know, there's often mixed messages.
Or like you should probably work out more, like the passive aggressive, you know, like the mother's own issues with her, like, you know, in middle age and attractiveness projects onto your daughter.
And and that's where a family therapist hears it in the family meeting, maybe confronts her on that, talks, and maybe there's a way in which she's not feeling attracted to her husband anymore, the two of them haven't talked about it. You know, if you can strip away the kind of, all the guck, the stuff that gunks up the relationship, things start to can really shake up. Well, let me give you this one. This is a case that, I know, it's one of those things you never forget in your whole life. All right, so this was in Michigan. I had this case assigned to me. She's this young girl. She was, I think, 13, and she kept throwing up her food. And she had been not intent. She claimed that we believed her after a while. Not intentionally believed. She did not worry about her body, but she would just find herself throwing up after every meal. And it got to the point where she just kind of did it. And this went on and on and on until she was hospitalized in the pediatric wing. And she was like 13 going on 8. It was something kind of very mousy, not mousy, she was cute. She'd be like in a Disney movie kind of thing, which struck us all as kind of odd. Like I remember the first session she talked about her friends and I didn't believe a word of it. Not that she didn't have friends. The only thing that was important to her was her family. That was pretty clear. So let me show you the family structures. Unbelievable. All right, so this is the father, this is the mother, and let's see, there was a boy who was in this is like during the Gulf War, this is in like 1990. So he was actually in the Air Force. He might have gone to the Gulf War, so he was like 21 and he was engaged to a girl that the family didn't like. Then there was a 20, let's see, no, that's wrong. Let's say he was 23. There was a 20-year-old sister. There was a 16-year-old sister. And then there was the 13-year-old identified patient. Let me tell you the story of this family. Father and mother grew up next to each other. He walked her to kindergarten. She was 5 and he was 7.
I feel like you get, like,
They never ever dated anyone else.
what they start dating.
And what's that?
What did they start dating?
In high school, I think. But I think they were kind of always dating.
According to Tango.
What's that?
According to Tango, Boy Meets World and now Girl Meets World.
I haven't. but the family was extremely close. They lived in what kind of house? How big a house did they have?
Small.
Very small. The 20-year-old was, if I remember, kind of tragically beautiful. She had this kind of sadness on her face. And she was going to a college that was a little college about 5 miles away. And she spent most of her time at the house with the family. So she wasn't dating anyone. I don't think she dared date anyone. And she was really kind of compelling. I remember thinking she was kind of weird.
What do you mean she didn't dare date anyone?
Well, the family was so enmeshed that, well, I'll explain more. The 16-year-old was the one that I called the spotter. And I saw a lot of families. I worked with this wonderful social worker who sadly died a few years ago, named Sharon Jordan in Michigan. And she was an African-American woman who had, I used to call her the judge. She had such bearing that like redneck families worshipped her. And redneck families in Michigan are more racist than like anybody. I mean, it's like, it makes Eastern racism look like just gentle. You know, like it's just horrible. But they adored Sharon. Sharon is like, she was the only therapist I've ever known who would write down what she was going to say before the session happened. I said, Sharon, how do you do that? She goes, things I want to get to. It always came up. So we saw family after family, and I learned. So we're talking to them, and what happens is the 13-year-old stops throwing up. And when she comes to the psychiatric unit, she's eating. She still claims she never was worried about her weight. She really wasn't. So we bring the family into the room, and we hear about the brother who's not there, and they're all very angry at him for being engaged to this girl. We find out the 20-year-old is living right near the house and coming home all the time. The 16-year-old is like a soccer player, and I had this thing I learned to do as a family therapist I played on TV, which was you notice something about the family and you interpret it the first hour. I notice all of you are such and such, and you wait to see who looks up at you in recognition. In my experience, there's only one person in the family systems, who carries the perception for the family, and it was the 16-year-old. She looked up at me like, and as I worked with the family and made interpretation, she just kept smiling at me like, whoa. Because she was not going to go to college nearby. She was determined to get out of this family. So the 13-year-old is wanting to get out of the hospital, and the family is saying you can't go out of the hospital yet. And the 13-year-old is having a tantrum. And Sharon says to her, just because you want something doesn't mean you're going to get it.
Yes.
Quiets the family down. Anyway, at some point, Sharon was so brilliant, she asked the older sister, she said, how did you feel when you heard that your younger sister was in the hospital? And the girl kind of answered a different question. Sharon said, you didn't answer my question though. How did you feel? She burst into tears, and everybody burst into tears simultaneously. It was like kind of thing you read about in books on family therapy, or you've seen on in videotape sessions. They all were so merged that if one person cried, they all cried immediately. Incredible. The family after that first session said there was nothing wrong with with her psychologically, that she needed to be back on the pediatrics unit. And the pediatrics unit said, I don't know, she stopped throwing up, or she entered the psychiatric unit. She should stay there. It's obviously working. And over time, we didn't have her very long, she began to refeed. And she really did gain her weight back. And we really talked to the family about the issue of enmeshment. And really, the 13-year-old, I think, was responding to the sorrow of the 20-year-old and the 23-year-old brother who was leaving the family. And we really talked about those issues. And then this one talked about how the dad was mean to the mom. And it had never been spoken in the family, ever.
Which one said that?
The 20-year-old. But she was saying it because she was very, very identified with mom and angry at the dad. This one, very identified with dad. Right? I'm sorry?
Whose dad also made her 20-year-old?
I'm sorry?
You said she was very identified with her mother.
Right.
So, I mean, yes, the dad was mean to the mom, but was the dad also mean to her 20-year-old?
Not particularly. They were complaining about how dad was to mom. And although they were holding hands the whole session. They held hands all the time. No, it's the most enmeshed family I've ever seen. And we set them up with a family therapist. They never went. I don't know what happened. But she did refeed. And from what we understand, she stayed out of episode as far as we know. I know. But what was weird was, it was an unconscious vomiting. It wasn't something she was trying to do. We thought she needed to have friends outside of the family. She felt very guilty about straying from the family. And again, so the idea would be that her illness was keeping the family from growing, from going to its next stage, which means tolerating the brother having his own family, letting that wonderful 20-year-old leave She felt so guilty she couldn't leave home at all. No worry about this one. She was just going to get out of there as fast as she could. Although that's just my fantasy. I don't know. It may be quite hard for her. I think I'm running out of time.
Yeah, like 5 minutes.
You know, I may not have time to get to the next one. So how about questions? Any questions about this? Yeah, I'll just go left to right.
Are there ever two identified patients in family?
You know, that's a great question. From what I understand from the literature, yes, but it's more likely there's one. And then there's one who is also symptomatic, but no one sees them. Like, I think this one was pretty depressed, but she wasn't seen as a problem, only this one. So usually the family confers one person to be the scapegoat. And that's what the IP really is. It's a scapegoat. It carries the illness for the family, allows the family not to think that they're sick. That's why you do family therapy with an anorexic person, and there's all kinds of stuff going on that's not being looked at because the spectacle of the anorexic girl, my God, she's killing herself! You know? It's like, we didn't do anything. We're not involved with this. We don't know what the hell happened. She must have a chemical imbalance. That's what it is. You know, well, sometimes. Who's next? Yes.
I'm an identical twin, and I'm just wondering if you've seen identical twins in family therapy, or if they've done any studies with that.
It's a great question, and I wish I was really a well-trained family therapist, which I'm not. But twins, carry their own issues, of course. Because we all do. So do youngest sons, and oldest sisters, and family therapists are really interested in the notion of differentiation. To what degree can you be your own person within your family while being intimate with your family? Because disengaged families barely tell each other anything. I once worked with a couple. He was having a midlife crisis. He was not cheating on her. They've been married 35 years. And he suddenly felt like he just needed something more in his life. And so they had this big crisis, and they saw me for about 4 or 5 months. And you know what it turns out? He told her he loved her once in 35 years. But he did tell her in one of our sessions. We finally got it out. But I remember saying to him, why does this scare you so much? He was near tears when he told her. And she was like, it's about time.
What did she tell him?
It wasn't so easy for her either, as it turns out. What's
When
that?
did they get married?
I'm sorry?
Like, how does that happen? What year did they get married?
They met in their 20s.
Yeah.
Yes.
How does race and socioeconomic status affect all this?
How does what?
Race and socioeconomic status affect all this? Because
It affects all of us.
yeah, because like the whole family.
I think family therapists would argue that race and class have their impact on the family system, but a family system is always a family system.
No, it's like I'm asking that. It's like I'm not white, obviously, but like I've had a conversation with somebody more than once, actually more than people. My socioeconomic status cancels out the fact I'm not white because we're reasonably well off. Like, but the thing is, it doesn't.
Of course not.
Yeah, but like they're just like, oh no. So the thing is, so like you end up getting a lot of the same pressures that you get with like.
Well, see, Americans don't discriminate as much against people of color who were educated. Because they talk like you and they buy the same cars.
Yeah.
And they buy into the American system. So you share enough, right? And I'm not saying anything it's particularly brilliant, right? But some family therapists, I got into trouble once years ago here in giving a lecture on this because family therapists love to study different ethnic groups and talk about their family systems. And then they sound like racists,
There is a difference. Like,
Yeah,
I mean, like a lot of
cultures. Well, I remember offending an Italian student once. An Italian-American student, because some family therapists argued, for example, that when looking at issues of power and leading the family, traditionally, I hope I get into trouble again, if you look at the kind of the stereotype of Italian families don't want their children to surpass them. They want them to equal them. That's why you'll often see, Roselli and son. You'll see Italians will often share their business when they're younger with their son and their grandsons, because there's a kind of come up to our level but don't surpass us, don't shame us. Whereas in Jewish families, it's like, you'll shame us if you don't surpass us. You've got to do better than we did. I mean, what? I'm giving you all this money for you just to, just be as good as me or less, God forbid. African American families have issues, and so, yeah, always. And I think a good family therapist really has to be, you have to, whenever I do these talks, I think I always end up with my own cliches, but, multiculturalism, you can't just say you're multicultural and then you're done. You can only become multicultural one relationship at a time. When I first came here, I had no idea the difference between Chinese, Korean, or Japanese cultures, or Taiwanese cultures, at all. And I didn't pretend I did. I'm multicultural, I have students from Asia. But over time, because I had relationships with my students, I have a rudimentary understanding of those differences, the way I do of the French and the Dutch and the German. I understand how cool Koreans are, I get it. But a good family therapist has to get to know those cultures. Yes, I'm sorry.
You spoke specifically about family dynamics and that environment, but what about peer-induced eating disorders?
You're just about out of time.
I
don't want you to get out of
Just to answer your question, I think, again, this doesn't explain everything. And there are going to be some instances where it doesn't explain as well. And again, if you're having an episode in college, it's less likely about your family system as directly as when you're 14. But I think the fact that this is what identified patients often look like is because of the culture. This pressure to be thin, this is crazy. It just is, but it's where we are, and it's being reinforced all the time. And just wait till, and then when women hit 40, the thousands of dollars spent on cream that will make you look younger, and all that. It's just horrible what you guys have to deal with. Guys always think they look good even when they look terrible. I think I look pretty good, It's like you look in the mirror and it's like, oh, what the hell? Come on, I'm all right. It should be more balanced, shouldn't it? You can borrow one from the other. I happen to be married to someone who is one of the few women I've ever met who doesn't have complaints about her body. She just doesn't. But then, she lives in Brooklyn, and we commute, and she said the other day, "I'm getting heavier than I like." "Oh, honey, I thought you were immune." Just have that little bit extra. I said, "It's just, don't think of it as extra. It's just you. Come on." Anyway. Oh, can I say one more thing? When this is something I learned from a supervisor who's really smart. He said, if a male client keeps complaining about his girlfriend's or his wife's body, it's because he's uncomfortable with his body. It's almost always a projection. Do you ever get that from a guy? Just say, how do you feel about yourself? These guys aren't comfortable with their bodies either. They just don't spend as much time thinking about it. They're busy feeling inadequate in other ways. Please don't think that as a gender you guys have it worse. You just have it different. Politically, as far as power and money and stuff, of course. And being victims of domestic violence, of course. But outside of those things. What's that? It's just that each gender has its burdens. I'm just, you know, I'm one of those guys who, you know, people have always cried in my presence, so, and told me secrets since I was about 10. So I'm exempt from some of my gender burdens, but believe me, I still have them. Anyway, I hope this was enlightening to some degree. Maybe it'll help you to think about, you know, your own family systems, because it's all going on. And if you want any references, maybe I'll link them. All right, guys, thanks for coming out.